Well, three themes really came roaring out of these interviews. Time, transparency and clinical engagement. And the time one broke down into several segments in the sense. There was huge frustration about the time it takes to do service reconfigurations and altering the way services are structured in hospitals, and a desperate desire that something needs to be done to speed that up. People found that very frustrating. There was a lot of complaint about the time it takes reporting back up and down the system, and from that came a sense that there were huge distractions from the day job, which was about improving services for patients. And one of the very striking things about these interviews was that all of these people volunteered that the job was about improving patient care, and that's what it was about, and they all volunteered it without being prompted, which is a strikingly different view of the world from the way they've been portrayed recently politically, whether they're described as pen pushers and bureaucrats, and it was very noticeable. That was not, certainly this selection did not think that way. They saw the patients at the centre. But they did feel frustrated about the time feeding the beast up and down, the time it took to reorganise and reconfigure. All that needed changing. In terms of what they wanted to see for the future and their advice for the future, they were all equally clear that clinical engagement was key to getting anything done. And again, that doesn't fit with the sort of public image of what managers are like. They all said that without doctors, nurses, clinical leaders at all levels, you get nowhere. And in a sense, the key part of the job was enabling these people to do their job properly and enabling the clinicians themselves to lead change. So that came out very strongly. And the final theme was transparency. They all, this might be the fashion of the moment, but they all felt that there needed to be much more data published about outcomes, clinical outcomes and performance. And if we did that, you might get the chance of peer pressure leading to an improvement in the way the NHS functions. It's worth pointing out that it's at least 20 years since Virginia Bottomley promised to publish loads more outcome data, and we're still edging our way towards it. But they all clearly felt that was a crucial lesson for their successors to try and help make sure that got done. Well, I didn't actually ask them about their optimism at the future. I asked them about what they thought about the reforms that are coming in now. And it has to say it wasn't entirely optimistic. It felt actually, we have to remember these are chief executives of organisations we're talking to, but I'm old enough and grey enough to remember 1990, what the 91 changes, which were incredibly controversial. But there was a definite cadre of people back then who saw big opportunities in the original purchase provider split coming in. And he had less of a sense of that here now. That there was this sense that there's this huge reorganisation going on, that there was a lot of skill being lost, that a lot of trusted relationships were being fractured. And one thing that came through very strongly was kind of where's the strategic leadership in the system going to be in the middle? So you've got the commissioning board at the top, you've got the CCGs, and the sense that what you might call the old SHA role is it's not very obvious where that is going to come from, and a worry that CCGs may not be able to manage major large-scale service change on their own. But it wouldn't be fair to say they were entirely gloomy about the future. They recognise that there's a possibility that clinical commissioning groups will help sort out poorer performing general practice. It does involve more clinical engagement, and that's all good. So they weren't sort of totally down, but you didn't get the sense that they felt that this was a reorganisation that they felt was entirely necessary. And the theme came back quite often that we could have done most of this without the legislation if only we'd been asked to and allowed to.